mainly for high school student. High school. This is mainly for high school students and the kids who are in freshman or junior year in college who want to pursue the medical and healthcare related profession. So Dr. Sai Kolla garu here. Sorry, Dr. Ram Kolla garu. His dad is a famous neurologist in New Jersey, New York area, and Ram is a, he's MD, physio. I think I'm
Physiatry.
sorry, yeah,
Physiatry.
I'm
I'm a physiatrist.
yeah. Thank you, sir. Go ahead.
Thank you.
Monica, go ahead and submit. First, you need to present what exactly you're doing for the next 10 minutes. After that, Dr. Kolla will talk about what exactly you guys need to do to get into the good medical colleges. At least.
Okay, sounds good.
Thank you.
This is the intern's U.S. healthcare systems presentation by Pranika Karela.
Dikshita Sanam.
Printa, you can go ahead, Amma.
Overview. Healthcare in the U.S. is a complex system, and it's intricately woven together by the needs of the
No, go ahead and submit. Go ahead and present it.
Yeah, Soumya is speaking.
Sorry, we can't hear you.
Can you hear me now?
I'll mute Soumya. No problem.
Hello, Soumya, we can't hear you.
Message better chori pade.
I'm going to reset my audio.
We can hear you. It's just a little quiet.
Can you hear me better now?
Yeah.
Okay, thank you. Overview. Healthcare in the U.S. is a complex system intricately woven together by the needs and supplies of various stakeholders. The main components of the system are insurance companies, hospitals, their employees, and the citizens who require medical attention. To begin, there's insurance companies. Insurance companies are the link for hospitals and citizens. First, they stock resources from businesses and individuals by providing financial protection for unexpected medical expenses and incidents. This way, people are able to access necessary healthcare without facing large financial burdens. Insurance companies are to secure different rates to ensure a balance between adequate care and affordable pricing. In the US, the most popular and largest insurance companies include United Healthcare, Blue Shield, and Kaiser Permanente. Their main role is to negotiate healthcare rates and encourage preventive programs. This way, the overall healthcare costs for patients will be reduced. Second, they cover financial costs for treatment, procedures, and medication, allowing patients to get access to the necessities they require. Their ultimate goal is to ensure that clients and patients receive appropriate care from medical workers and have a defined network of resources to utilize in their unique medical journeys.
Hospitals. Hospitals are the center of healthcare delivery and present a wide range of services, such as specialized surgeries, emergency assistance, or yearly checkups. Their workforce employs individuals like doctors, nurses, and administrative staff to bring forth the most effective and diverse amenities towards a patient's well-being. Their main role is to 1. Offer an all-inclusive range of medical services which vary not only in complexity but also in the area of focus. 2. Put money into modern medical technology and research to improve patient outcomes.
Food box.
What was that?
Sorry.
Okay. 3. Contribute to public health initiatives, engage in outreach programs / host volunteer projects. Their ultimate goal is to implement the most productive workers, strategies, and technological resources in their facilities to provide direct and appropriate care to those in need.
Citizens. Citizens are the primary beneficiaries on the American healthcare system. Individuals rely on favorable insurance policies in their local hospitals to aid them in navigating a scope of healthcare situations. Although citizens cannot do much for themselves other than living a healthy lifestyle, they can also contribute to the flow of the system by using healthcare services wisely, taking initiative towards learning about health education and supporting local organizations. The main role is to 1. Be responsible and do not misuse healthcare services. Try to seek preventive care and manage chronic conditions timely. 2. Learn about how healthcare and the body works, and advocate for improved healthcare policies because your voice and concerns will help the systems. 3. Not only live healthy lifestyles, but promote nourishing ways of living to others within the community. Stakeholders.
Patients. Patients are the most important stakeholder since they are making the final decision about their care. Modern day health research is reaching to involve patient stakeholders as active members of research teams so they have a more involved role in their own healthcare journey. In addition, patient and doctor trust is important and needed. Open communication between a patient and their physician could lead to diagnosing the most effective treatment and ongoing care. In addition, patients will feel safe, supported, and confident in their care. This leads to better satisfaction on both sides.
Insurance and government agencies are usually in charge of finalizing payments for patients, provide access to care, uh, manage costs, fund research for companies, implement health policies, and lead public health initiatives.
Pharmacy and medical device companies are also important because medical devices are developed to help patients. Such devices are like pacemakers, shunts, etc. Medication management is making sure proper meds get to the patient, which is very important. They also provide vaccination services. Along with that, pharmacists are the most accessible healthcare professionals. Innovation and development, which is marketing new tech to improve treatments, and pharmacists educate patients about their medications, giving them a better understanding, making pharmacy and medical device companies a very important stakeholder since they're the most accessible.
Physicians and doctors. These individuals provide patient care and are the center point for a contract. It's vital that they uphold ethical standards in medicine because they hold complete responsibility for a patient's life. In addition, they are also responsible for training med students, residents, and other healthcare professionals in hospitals or their own workplace.
Academic institutes plus advocacy groups are in charge of research and they find new procedures that will eventually help future patients. They also teach future healthcare professionals. They contribute to healthcare advancements, keep the healthcare system in place, and serve as a voice for patients overall.
Obamacare. Obamacare, officially known as the Affordable Care Act, ACA, sorry, I can't, hold on, is a significant healthcare reform law enacted in the United States in 2010 under President Barack Obama's administration. It aimed to increase the quality and affordability of health insurance, expanding coverage to more Americans and reducing the overall cost of healthcare. Some key things to know are 1. Individual mandate. Individual mandate is one of the most debated provisions required most individuals to have health insurance or pay a penalty. This aimed to ensure a larger pool of insured individuals, spreading risk and potentially lowering premiums. Second, insurance marketplaces exchanges. Obamacare created online marketplaces where individuals and small businesses could shop for and compare health insurance plans. These marketplaces offer a range of plans that meet minimum essential coverage requirements.
Third, subsidies and tax credits. To make insurance more affordable, the ACA provided subsidies and tax credits for low and moderate income individuals and families purchasing coverage through the marketplace. This helped offset premium costs and sometimes out of pocket expenses. Fourth, Medicaid expansion. The ACA aims to expand Medicaid eligibility to cover more low income individuals and families. However, a 2012 Supreme Court decision made Medicaid expansion optional for states. leading to a patchwork of coverage across the country. Fifth, protections and benefits. Obamacare introduced consumer protections such as prohibiting insurance companies from denying coverage based on pre-existing conditions and allowing young adults to stay on their parents' insurance plans until age 26. Essential health benefits were also mandated for all plans, including coverage for preventive services, maternity care, and mental health services.
Employer requirements. The ACA introduced mandates for large employers, typically those with 50 or more full-time employees, to offer health insurances to their employers or face penalties. Small businesses were provided with tax credits to help offset the costs or providing insurance. Quality and efficiency initiatives. The ACA promoted initiatives aimed at improving the quality and efficiency of healthcare delivery, such as encouraging accountable care organizations or emphasizing preventative care. Taxes and fees. To help fund the ACA's provisions, certain taxes and fees were imposed on high-income earners, medical devices, and health insurers.
And that is our wrap to our U.S. healthcare systems presentation.
Awesome job, team. I thought did you cover the Medicare and Medicaid also? Did we cover that? Medicare and Medicaid?
Yeah.
Okay,
They
that's
did.
fine.
They did a perfect job. They covered
Thank
all
you.
the aspects of medicine.
Perfect, sir. Thank you. That's what I wanted to do, them to do it. Now it is up to you. Now how you can motivate them and encourage them, become a future doctors.
No, not like that. What do you guys really want out of this talk here? Like anybody can tell,
Guys, you can
or
speak up. You can speak up. What exactly you're expecting from the internship opportunities? Is that what, doctor? Is that what you're asking?
Like what I'm expecting from the internship.
Mhm. Okay. First, let's do one thing then. So let me start about how the medicine is here and medical aspect, and how to become a doctor or a PA or a nurse practitioner or any kind of technicians that you guys want to be. All right. First of all, medicine in the United States is a 4 years high school, 4 years college. Then you take MCAT. Does anybody know what MCAT stands for? Medical admission test. And a 4 years of medical school. And after 4 years of medical school, we'll try to go into residencies. And residencies, the first is primary care, internal medicine. Then you get the surgical specialties for 5 years. And after these things, then you can go up with internal medicine. After doing 3 years of internal medicine, you're going to do 3 years of cardiology or 3 years gastroenterology or 3 years of nephrology, hem-oncology for 3 years. Thereafter, internal medicine. All right. And after that, then there are a couple of years they can do a super specializations on top of this. And let's go for general surgery. General surgery is around 5 years of residence. And after that, you can pick and choose your specialties later. And orthopedic surgeries is 5 years, neurosurgery is 5 years, dermatology 4 years, ophthalmology 5 years. If I keep on going there, you have emergency medicine, anesthesia, pain management, you have family medicine, which is 3 years, and you have physiatry, that's me. I'm a physiatrist that I take care of musculoskeletal muscles and bones, neurology, radiology, and in radiology is 5 years, and after that you can do a super specialty. This is a small overall of what you guys are ending up with. All right, high school, 4 years college, 4 years medical school, residence for 3 years. After 3 years, and it all depends what you guys want to do. All right, is everybody clear on this?
Yeah.
Yes.
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 All of you guys who are interested, you need to have this kind of overview of what you guys are going to end up in. So, how many guys are in high school now? Can you give me a count? Like in this group right now, how many guys are from high school?
Dr. Garu, I think all of them are in high school. Maybe one or
All
two.
of them are high
Anyone from college? Anyone in college? Anyone in his college? Maybe those two kids not joined the call. I think remaining all are right now.
All right.
Yeah.
The first thing is first, you guys need to have good scores. Your GPA should be good. All right. The highest GPA you can get, first of all. Next is volunteer hours. Next is research. And if you guys have any kind of science Olympiad in your schools, do you guys have anything, that kind of thing? Anybody have science Olympiad in your high school? Kids, yes or no? Are you guys muted?
No.
No. So is there any of your schools have any science, what do you call, okay, you guys are texting me, all right. So if you have anything in a school, a science Olympiad or science, with science programs, you should definitely join them. It's very important. The next is hours of shadowing with medical officers, that at least you can have a taste of it, what they do. Or in the hospitals, you need to volunteer yourself. And the other part of it is research. Okay, research, you need to talk to your school guys who are school principal or any science teachers, and an opportunity nearby to get research into it. This is very important to put your feet into research, right? To keep your application good, you can have a little bit of known as, you can have BCLS, Basic Life Support certification. All right, you guys need to write down all that stuff. EMT certification. If you are, you can get trained in EMT, that will give you a big thing. You can prepare some TED Talks on whatever topics you like, and volunteer hours. All right. You can also get some medical assistant certification. That will give you, or these things will give more. Your application will be more competitive when you have this. All right. So let's talk about research. Anything that you can get hold of it. It doesn't need to be very big or small, but you should start early in your high school, maybe in 9th grade or 10th grade. Everybody sees that how you're interested in, or is a prolonged, what do you call, how can I put it? It should be a prolonged research that you're interested in. So, okay, you do it every summer. All right, you don't need to do every day, but every summer you're in the same topic of research that you do. So that will give you more advantage. That will give you the impression that you are interested and you're for the long run. That is important. Then volunteering doctor's office. Whenever you get a chance, you can volunteer in doctor's office. All right. And other thing is, you guys need to learn how to write papers, publications, how to write an abstract. Later, I think so. Now, I think I'll send you a link. There's a small certification known as Research Laureate Certification, Science Research Writing and Certificate course. It's not laureate certification. This is a science research writing modules that you can go through it, and everyone gets certified in it. And that will give you a gross idea of how to present a paper, how to write a paper. I'm going to put the link later. I don't have the link with me. I'm going to share with Om. So, and everybody's trying to say an internship in medicine. I don't think so. There are other things. Sorry, are you guys all from New Jersey or some? You're joining from other places.
Dr. Garu, only 3 or 4 people are local. Remaining all are across the nation.
Across the nation. All right, guys. So for New Jersey guys, there's one at Cooper Medical School. It is Camden. They usually conduct 2 weeks of kind of internship kind of thing. They will let you see, and they'll show you what is in medicine, what kind of departments they have. They have, it is a 2 weeks course. I think you need to write a test before you get into it. But any high school or any kids that are in any part of the in the country, they can talk to the science teacher, okay? And the science teachers, and they have links to research programs or research professors, then you need to email them, everybody. You should start emailing from the 9th grade itself. You cannot, if you want to go to medicine here, you cannot start in 11th grade. You have to start from 9th grade itself. 9th, 10th, 11th, you're done. So by 11th, you should have all the application be done at the end of 11th. So that is very important. So that's for high school kids. Volunteer hours, shadowing, physician, shadowing, research. And if you have something on science Olympiad in high school, that is very important. And research to write papers, you need to have some kind of training in it. So that I have the laureate certification. That's good. I've gone through that. That will give you in-depth how to write a paper, how to read a paper. And once you start doing research, your paperwork will be very good. The writing skills will develop very good. That you'll be very comfortable in writing them. So next, again, the same thing, MA, BCLS, EMT certification, any TED Talks you can go. Or another thing is, this is what I got from Dr. Kumar Kottapaligado. He's a genetic scientist. He's in Dell Medical School. When I was talking to him previously, he was saying that anybody can get a hold of volunteer hours in veterinary, animal veterinary doctors for, if you can get a hold of a veterinary like observership or like kind of shadowing in a veterinary or vet office, and that will be a plus point in your application. Another thing is medical camps. If we can conduct some medical camps, and other countries too. If you go back to India, you can just shadow, not shadow, maybe any kind of medical camps they conduct there. Will have a different exposure, and the medicine will be different there than here. How we do it, we will get some exposure. And then that will also give some kind of opportunity to put in a resume. So I think I did cover most of it for high school kids. Do you want me to ask any questions?
Ram garu, there are a couple
two
of questions in the chat, Andy.
Yeah, Shashank, go ahead, Shashank, go ahead and ask the questions.
Yeah. Dr. Ram,
let student ask the question. Students,
yeah,
you can ask the question
I'll
directly.
I'll call them. So, Pranika Kurella, you have a couple of questions. Can you unmute yourself and ask?
Yeah, I'm gonna be a sophomore this year, and I was just wondering, because I heard that we could do like individual research topics through this program, and I was wondering if like there were any.
Or individual topics for us to do any research. See, I'm a private practitioner, all right? Individual topics, if you guys get any topic that you're involved with, I can guide you through.
Okay, so
because
we should...
what happened, give me a second, sorry for interrupting you, because I'm based in New Jersey, all right? And I have a lot of ATMIYA people coming to me. They usually shadow in my office, and most of them are high school kids and some of the college kids too. I do get those kind of people here, and I do give them recommendation letters, and they've got into medical schools. Shadowing, and you're right. If there's anything you are interested in, if you have a topic, we can sit together, or we can guide you in.
Okay, so I should come up with the topic and then message you about it, and then we'll set it up.
Yes.
Okay.
Yeah, thanks, Dr. Garu. Thanks.
No.
Dr. Garu, maybe each student may come up with a different topic. Maybe you can.
Yeah, let's see
come up with
topics. Some of the topics that we can go through, and one thing is the topic wise, they have to connect with the school. Is very important because see, they need to have some guidance on hands-on guidance. I can do it. We can do the offline topics, but the main thing here is even sophomore, they have science programs there, and there's some research professors they're linked to their schools, and that's very important. They need to get into that. These are sideline ones, which whatever we do here, it is as an add-on.
Yeah.
Great, Ram Garu. Yeah. So the takeaway is the student should come up with the topic for the research so that they get involved, before they approach you. Yeah. Thanks, Ram Garu. So the next question is from Pragnya Kolla. Pragnya Kolla, do you want to unmute yourself and ask?
Yeah, thank you, Uncle. So this is Pragnia Kolla, and I'm entering 12th grade, and I finished the rest of the programs that you wanted us to do before applying for medicine. But I haven't done a research internship yet, so I was wondering if there are any opportunities that I could enter through this program.
You're in 12th grade right now. You finish your application?
I haven't finished my applications. I'm entering 12th grade now.
You're entering 12th grade.
Yes.
So if you're entering 12th grade, then January 1st is the deadline, am I right?
Yeah, for most schools, yeah.
For most schools, yes. But if you don't have any research right now, but you have shadowing, do you have anything else, voluntary hours? You have all those things?
Yeah, I have shadowing, volunteering, and yeah.
So are you trying to get into 7-year programs?
Sorry, could you say that?
Are you trying to get into 7-year program or 8-year direct programs?
Not really. I mean.
Okay, if you're not entering to direct 7 years program or 8 years for direct BS MD programs, I don't think so. Research is a big thing for you.
Okay.
All right. If you're applying for an BS MD programs, that is a direct program, then I think there are no more 7-year programs. I think if I'm right. In Texas, I think everything is 8-year program. Is a direct program that you compete for the whole 8 years at one shot. So at that time, the research will give you more edge on application. For regular colleges, where you have to go to pre-med, research, it won't be a big difference for you.
Okay, but would you suggest entering the direct BSMD program for 8 years?
It all how what do you want? You're definitely decided that you want to do medicine. You're not going to change yourself, and you can give it a shot for 7. But it is a very tough. It is very competitive, highly competitive.
Yeah.
It's very highly competitive.
Okay.
All right. The best thing is, see, medicine. You can take any group that you like. All right, you can take liberal arts too. Then also you can go to medicine.
Okay.
Guys, everybody listen. If you want to go to medicine, it is not only pre-med. All right, you can do anything you like, any major you like, but you have to finish. You have to maintain a good GPA, and you have to do Bio 1, Bio 2. What is that? Organic chemistry 1, organic chemistry 2, and physics. All right, and these are very important for you to take the MCATs. There are certain requirements, certain subjects you need to take for MCATs. So if even you do liberal arts, and if you do this, you're eligible to do medicine. All right.
Okay.
So you guys can choose psychology is also good. Anything which you can get a good GPA and good MCAT scores. MCAT scores are very important
Okay.
when you go for medicine.
Okay. Yeah. Thank
Okay?
you so much.
Yeah.
Yeah. Thanks so much, Pragya. Thanks, Dr. Ramgaru. Ramgaru, we have one more question, Andy, from Monish Allada. Monish Allada, do you want to unmute yourself? So this is a very frequent question, Ramgaru, in our community groups as well, local community groups. Monish, you can go ahead and ask it.
Yeah, my name is Monish. I'm going in a 10th grade, and I'm just wondering, like, you said we had to have like shadowing in doctor's offices and like internships in doctor's offices. I'm just wondering, like, how can we find those opportunities, and like, how are we able to apply for those or like get those opportunities?
So basically, there's no much internship in medicine. All right, they do have some of them in some hospital only. I know one which is in New Jersey, but other places I don't have internship per se internship, but they have voluntary services in the hospital. Okay, they do give volunteers. You can join as a volunteer in the hospitals, then you'll get to know how the hospital works. And if you can go to the regular doctor's offices nearby, email them, or somebody in the doctor's, you can shadow them. That's how it works. And research, the best thing is to go through your schools. Right? Again, I'm telling everyone here, research is very difficult to do it outside in the school systems, especially after COVID. It has been very difficult that they're not entertaining kids to come and do the research. But the professors and the schools that are affiliated to research professors, they do get it, but you need to persistently email them. They'll definitely answer, but it is from your side. It is not your mom, it's not your dad who's forcing to do a phone call or an email. It is up to you guys. You should be persistent in doing the emails. I repeat this, persistence and persistence. It should not be your mom or dad telling you guys, hey, did you email him? Did you get an answer? Did you text the professor? No. That is very important, guys. Persistent, talk to your guidance counselor and talk to the science teacher in the school. It has to, you guys need to, by tomorrow, if you are guys really interested in medicine, everyone in high school, tomorrow is the one you're going to email your guidance counselor that you want to do this. Okay?
And it is your right. Don't be shy. It's your right. You can go and ask. If they don't have it, you will say no, but at least they'll give a guidance. Ask them.
No, they have to. They have to go and ask. They have to go and ask.
Yeah. Thanks, Monish. So the takeaway from this is you need to first take the initiative and find out the emails of the doctors from your local, office, doctor's office, and email them, especially for shadowing opportunities. Dr. Ramgaru, this has been a constant ask in the local group Sunday, especially kids who are in high schools. Parents are just posting that if there are any shadowing opportunities, let us know. So that's the reason I stressed on this.
From my end, from New Jersey, I've been doing that for the last more than 10 years. I've been doing it in my office. So my office is open for everybody, but we have timings, especially in COVID, we couldn't take anybody. That's a different story. But I had a person, I need to tell you this story. I had a college kid, because in COVID, nobody let anybody to come near to the offices. This guy is from Boston. His mom used to drive him from Boston to New Jersey, 5.5 hours drive. Every Monday he used to come. And he used to go back.
Wow.
He did it.
Got it.
He wanted to. He was very passionate. I'm telling you, he was very passionate. He came from Boston. The mom used to drive here. Mom used to go to the mall. He used to stay here, pick him up, go back to Boston every week. All right.
Yeah.
So if you say it's very easy. You have my WhatsApp number. You have my messages. You can guys text me. But the thing is, I'm a little bit bad in responding back. But I do respond. But you keep on. If you have any questions, we can talk. We can guide you in it.
Yeah, thanks, Ram
What
garu.
we
That was
do
one
is
of the question, Andy. Yeah, how
Mhm.
would we
Dr. Garu, we'll
contact
collect the
Ram?
questions. We'll collect the questions, Dr. Garu. I know students I know it means too much for you. Unless you are ready for it, you can collect the
I'm ready
questions.
for it. See, let them have
No,
an
no.
See, let
Okay.
them have a small, whoever is interested, let's have a small WhatsApp group. Like
Okay, we'll create a
not
WhatsApp group,
like,
sir.
who are
Sir,
interested.
Ram Garu, we have Slack group. Do you mind joining the Slack? It is really nice. I will ask you to join the Slack group. The kids may not be because of privacy issue and everything. The phone numbers, Slack is the best. I will help you to help you to install Slack. Okay.
All right.
Go ahead.
All right.
Yeah, Slack.
Sir, go ahead, Amma.
Yeah. So thanks, Dr. Ram garu. So Dr. Ram garu, one other question is from Akshaj Sunkara. Akshaj, do you want to unmute yourself and ask?
Yeah, sure. Hi, Dr. Ramakachandra.
Hi.
Okay, so basically there's a program at like our high school and it like allows us to get a certified medical assisting certification. But the problem with that is that it goes like in like 12th grade and we only get that like at the end of the first semester. So would it be like worth pursuing that for like liberal arts or BSMD like application? Because we would only get the certification after most of the work is done.
Most of the work. You can put it as pending, you're still doing it. Or see, the other ones are EMTs are good, certification wise. BCLS is good.
Mhm.
So if you need some certification, then these are also good. EMT is very good. So if you can do it earlier, EMT or like in 11th grade or so, is very good. So this is the one you're talking medical assistant, am I right? The certification?
Yes, it's for certified medical assisting.
Certified medical assistant. Yeah, that's true. Like it's almost end of your, like almost you'll finish your application before you get the certification.
Yeah.
That's a tough one. But you can do other certification on your own though. Other certifications, you're talking about high school, am I right?
Yeah, we also there's
Yeah.
like also an EMT program, but the problem with like it also has the same problem. Like the certifications come out like end of second semester or first semester.
First semester.
Yeah.
Then you have to write EMT experience and medical assistant experience, no certification. Will be certified, maybe something like that in your resume.
Maybe, yeah. I think I'll try that.
You try that. But otherwise you have to do something else outside, but on your own. Remember some of the things that you have to do it outside. See, that's too late.
Yeah.
And anything else you have in your school? Where are you from? Can I ask you where are you from?
I'm from Dallas.
Dallas. So what do you have in your school? Like what else? It's an allied school?
No, it's a public school. We have like
Is it
yeah, so we have a pharmacology program as well, but all of these like what is it, certification programs, they like get the certification after the first semester. So
After
it would
first-
like yeah, so
Okay.
it would be a problem like to say that
You
I'm
know
certified.
why they do you know why they do that?
I'm not really sure, but I'm thinking it's like to make sure that like the students that are in that program are actually dedicated to medicine.
No, not really. See, these certification are a certification they can go for a job. After high school, they're not. These are like kind of plumbing and electrical stuff, right? So you have the certification, you have EMT certification. The guy won't do a college. Most of them, they go, if it's a public school, most of them, they go directly a job for an EMT job because he's certified in. So that's the reason you have those stuff at the end of the end of your school thing. So the last one. So once they get that, and if it's a public school, then they may not even do college. And that's the reason you have that.
Okay, all right. Thank you.
All right. Yeah.
Yeah, thanks, Akshay. For everyone attending the call, I posted the Slack group link in the chat. So please join Slack. Ramgar, if you have some more time, there are a few other questions, Andy.
Yeah, go ahead. Let's finish up.
Yeah. So the next question is from Sri Pediredla. Sri Pediredla, do you want to unmute yourself and ask? Yes.
Hi,
Sri
Dr.
Pediredla.
Ram. Yeah.
Yeah.
Hello. Yeah, are the paid programs, especially there are some programs like some doctors are giving research programs and other stuff. Are they legitimate?
There are legitimate. Why these the paid programs came up as because of the USMLE foreign graduates were supposed to have an US training, a US a kind of internship kind of thing. So they started a paid programs. That thing is for 3 months or so. So it
Okay.
is for them. That's how.
But it's very expensive, sir. They're asking like 5 to 7 grand. And those are all
Yes.
clinical research. And so my daughter is in first year completed, and we are looking for research and clinical side
Is
internships.
college-wise you're talking about? She's in college, am I right?
Yeah, she's in UCI, pre-med, biological sciences.
Biological sciences. So did she ever get into our professor and labs?
No.
No, that's what it is. In the first year itself, you need to email them, you need to talk to your seniors and get into the lab.
Yeah, she got this summer into KGI, Keck Graduate Institute, some program she attended, but unfortunately she couldn't get any hands-on. It's an on-site program, but she couldn't get into the clinical side of program. It's more of research and other stuff. Yeah.
See, the clinical, you don't need to do only clinical. Most of them, they like basic sciences.
Okay.
In the applications, they like basic sciences, it's not clinical. See, they don't have good clinical knowledge to get into research aspect. But if they can do on basic sciences, that will be very good for the applications. See, you need to know they're not clinically, they don't have clinical experience at all.
Got it. Okay.
Do they have any?
So you still recommend the paid programs?
If you can pay it, there's no harm in it. If she's not able to get anywhere, she's not get hold of any kind of research, and then at least that will be there.
Okay. Sir.
That piece of it, it will help.
Right.
But she needs to
this
shoot
summer
for basic sciences. That's the
basic sciences.
Yes.
Okay. Thank you, sir. Thank you so much.
Yeah. Thanks, Andy. Sri Pedrilla garu. Thanks, Dr. Ram garu. Last question, Ram garu, from Chakrapani Madharaju. Chakrapani, do you want to unmute yourself and ask?
Yeah. So, can you hear me okay?
Okay, this is more of a question, and it's a statement, Andy. Some of those certifications need you to be 18 years old. Organizations allowing teen EMT certifications are very rare.
EMT, I think, should be 18. I think so, should be 18 EMT. And I think the BCLS and what do you call medical assistant, I think they don't need 18 for that.
Right. Yeah. Thanks, Ram Garu. I think Chakrapani is here.
Sir,
Do
we
you
can't
want
hear
to
you,
say
Chakrapani
something?
garu. We can't hear you, Chakrapani garu. You're talking very low, as if you are unwell. Okay.
Yeah,
Anyway.
seems to be some mic problem, Andy. Om Garu. So,
Yeah, it's good.
Om Garu,
Thank
I
you.
think those are the questions, Andy. You want to say any concluding words and thanks to Dr.
No,
Ram?
thank you, Ram Garu. Ram Garu is busy
You're
with his practice since morning. So thank you, Ram Garu, for
No, I'm
short
still at
notice
work.
posting.
Not a problem.
He's still at work. Thank you very much, sir. Thank you for joining and helping with the kids with all the knowledge you have. And he's also, whoever in New Jersey nearby, you can come during the August and the remaining part of the July. Dr. Garu will help you with shadowing opportunities. Atmiya will also help to find out the local doctors who are in California, North Carolina, Texas. We'll request them to give a shadowing opportunity. But given the doctors are busy, we cannot guarantee anything. One last thing is, all of you, your parents and your mom and everyone needs to come to the ATMIYA conference happening at the Dallas for long weekend, September long weekend. Doctors will be there. You can talk more about. You can talk, and we're doing a medical camp also for seniors. You can be part of the camp.
That's a good opportunity, guys.
And also we're doing the blood drive. So join those meetings. Ask your parents to sign up immediately right now. Come to the Dallas on August 31st and September 1st and 2nd. You will have a great opportunity. You will be talking to a lot of doctors. Okay?
Yeah, and
With that,
Omgar,
thank you.
Atmiya is also offering a volunteer hours, Sunday. If anybody is interested to volunteer for the continuous medical education camp, which Dr. Ram Kolla Garu and other doctors are organizing there, please feel free to post in Slack that you're interested, and we can form a group accordingly.
Yeah, thank you. Thank you, Dr. Garu. Once again, really appreciate it.
Thanks, Andy Ram Garu.
Okay, thank you, everyone.
Thank you, Om Garu and Dr. Garu. As always.
Thank you, Andy.
Thank you.
Thank you, Dr. Ram Garu.
Thank you very much. I hope everyone liked it and had a little bit informative.
Thank you so much.
Definitely, it's really helpful, Dr. Garu.
Welcome.
Thank you.
You're welcome.